Good evening, everyone. Welcome to blackdoctor.org. Here we are again. I am your host, Dr. Renee, and tonight we have two really fabulous guests, one doctor and one patient. So ladies, if you are out there, first of all, you know I have to do my housekeeping. Please like and start a watch party. I know that you know somebody that has fibroids, or they've been complaining of a lot of symptoms during their cycle, and you don't know what the problem is. It might be fibroids. So we're going to discuss fibroids tonight. So men, get your women. And ladies, come on. Let's make sure that we get this information out to our community. Fibroids are very common in Black women. We'll talk about that too. So please make sure you like blackdoctor.org, the page, which is over there somewhere. There it is. And then start a watch party so that other people can see this. So tonight, joining me, we have Dr. Nicole and Tanika Gray-Valbert. Now, Tanika is going to tell us about her amazing organization, which really is based on fibroids. And Dr. Nicole is going to give us all the information because you guys, you don't have to have a hysterectomy, right, Dr. Nicole?
Exactly.
Yeah, so that's what we're going to talk about. We're going to talk about what you can do and what you should do, and the conversation you need to have with your physician, because this is definitely something that's very sensitive. And if you don't feel like your physician is meeting your needs, you guys need to find a new doctor. I tell you that all the time.
Absolutely.
So thank you, ladies, for joining me this evening.
Thanks, Dr. Renee.
Thank you, Dr. Renee.
Oh, you're welcome. So let's start from the very beginning. For those that don't know, what exactly are fibroids? And Dr. Nicole came with pictures, you guys. So we're going to show a little picture.
Thanks, Dr. Renee. Dr. Renee and everybody, thank you for having me on. Fibroids are the most common tumor that occurs in women. It occurs generally more in African-American women, and they can happen basically anywhere. So this is this adorable picture of a uterus, but it's full of fibroid tumors. So there's different types of them. They can occur in the uterus, in the uterine cavity where the babies are supposed to be. They can happen on the outside of the uterus. They can happen on the inside of the uterus, basically everywhere. They can be as small as peas and get as big as watermelons. But generally, you should know that they're usually not cancer, but they can cause a hell of symptoms like pain, pressure, painful sex, and most of all, heavy, heavy periods.
So this is something that I think people don't, they can't tell what is the definition of a heavy period.
Aha! Thank you for asking, because if you look at the data, when women are asked, oh, is their period heavy? The funny thing is the women with the heavier periods think their periods aren't that bad. And the people with like normal periods, like, oh, I'm just like, oh my God, I'm dying. Well, heavy period is if you are filling up a pad or you have to change your tampon, any type of protection, within an hour. If you fill up a pad in an hour, that means your periods are too heavy and you need to be checked out. In addition, if you have your period and you feel like, whew, you get short of breath, you can't climb a flight of stairs, like regular activities, your brain doesn't work, you get palpitations, things like this tell you that you might actually be anemic. And so many of my patients are walking around with anemia that any of my patients, when they say, oh, my period's a little heavy, I check them. About 70% of those women are anemic.
Yeah. So you guys, this is all to say that you don't have to be living in such pain.
Nope.
Right.
And you don't have to be walking around groggy every, time of the month, every month. Can you imagine every, 5 days or whatever it is, a week of the month? And some people who bleed longer, You don't have to have that. So Dr.
Right.
Nicole, thank you for telling us that this isn't normal. You don't have to be living like this.
And cheers to having normal periods.
Yes.
Yes.
So Tanika, can you tell us, because I know especially the White Dress Project came out of this, can you tell us how were your periods that made you say, I need to go see a doctor, something's not right?
Yeah, so my periods were horrible and still are kind of horrible, and horrible in terms of what Dr. Nicole described, which is I would change pads even 30 minutes or an hour, just like she described. And I really actually thought it was normal, like she suggested. Like, I really didn't think anything was wrong. I was kind of taught that, you know, women just have heavy periods. You just learn how to protect yourself. So for a very, very long time, I never knew anything was wrong. I started to get a signal when I started to become severely anemic. So the fatigue, I was always that girl in college that had to take my afternoon nap, and my friends knew that, right? So the fatigue, the pica, I had, you know, wanted to eat ice all the time. And I know this sounds gross, but dirt and smelling soap, all of those symptoms that Dr. Nicole can elaborate on, that when you're iron deficient, anemic, that you begin to have those symptoms. So yeah, for me, it was nothing to change a pad every 30 minutes, every hour. To put it into more perspective, I have never worn a tampon in my life. And I remember going to the grocery store, you know, to pick up pads, and I'd be like, who's wearing these tampon things?
Because they're so tiny.
Right. So it's really a point of us normalizing the conversation and normalizing periods, and not understanding that, no, we're not supposed to be bleeding like this. We're not supposed to be clotting like this. And we aren't supposed to be bent over in pain. So I love conversations like this. And thank you, Dr. Renee, for always thinking of me, because it's important to not only hear the clinical aspect, but also to hear a patient perspective.
For sure.
Definitely. Definitely. And I know that there's many women, because they've been tagging them in the comments, a lot of women that completely relate to what you're talking about. So how do you have the conversation, Dr. Nicole? Because, you know, I know you and I both know we can't stand a Google doctor.
Oh,
God. Right. Drives us insane. But there is information out here that not necessarily does your physician know, because Dr. Nicole does a special procedure that not everybody in the country does.
Right.
For fibroids. So your doctor may or may not know about this procedure, and for whatever reason may or may not want to tell you that this is a possibility.
Well,
so
you know, business.
Exactly. Business. I completely get it. But let's be honest, Black women have gone through enough, Black people in general, but Black women have gone through enough. Sure. And your doctor just might give you a hysterectomy just because of general purposes.
They don't feel like being bothered.
Exactly. They don't want to hear you complain anymore. Nope. And they don't want to do any more research. They don't want to figure, they're just done. So, Dr. Nicole, please tell us the options, because I think it's so important.
Great. Thanks, Renee. Let's go through some of the options. So I always start with medication option. Now, most doctors are just going to say, well, here, just take a birth control pill. But if you don't want to be on birth control, what if you might be trying for a baby? You can't be on birth control pill for that. Then there is a medication called TXA that helps to stop the bleeding faster. So that's one, and that's a medication. There are newer medications. There's one called Orion, which is a combination of an endometriosis pill and then a low dose hormone. And we use that kind of like as a bridge. If you're not quite ready to have surgery, but you're still bleeding through a pad an hour, you're still feeling tired, you're still in pain, then we need to do something. Because I tell my patients all the time, you're still alive. You want to be productive. You want to have a good life. You don't want to be knocked down for 5, 10, 14 days out of the month. So that's why I talk about medication options, because I have some younger patients that are in their 20s. They're not ready. So we talk about medications. And then the next thing we do is, okay, we have some surgical options, but it really kind of depends on where you are in your fertility journey, if that's something that you want to do. So if we're talking about, I have larger fibroids and I really want to have a baby, then the idea, we got to get the uterus down to something small, because conception occurs way down in the pelvis. If you have a really big uterus and it's sitting out of the pelvis, then if my little tubes are here and my tiny boobs are ovaries, and if my uterus is so big, it sits up like this, I can never reach, my egg can never make it. If you look at this picture right here, you see how the tube is sitting on the ovary. They don't exactly sit to the side. They just do that for the picture. It actually sits in the front. But if the uterus is so big, the tube and the ovaries can't touch each other. then
So you guys, the ovaries are these the yellower structures. The white structures are the fibroids, just so you know. So those little hands are holding ovaries, you guys. Those are your fallopian tubes holding ovaries.
Exactly. So if your uterus is so big that the tubes are way up in the pelvis, they can't find anybody. So we got to get it down. So if we're talking about large fibroids, then I make a small incision way down at the bikini line, and we have to remove each one. But I actually do it through the mini lap. And what we found is that we can take each individual fibroid, remove it, sew everything back up, and then move on to the next fibroid without taking out the whole uterus, which is a really nice way of accomplishing that with an incision of about this big.
I remember in med school, a hysterectomy, and I was like, oh my God, what are we doing? And this lady was, just say she was a larger person, and that surgery took so many hours. I was like, this is horrible.
Yeah, so we try not to do a hysterectomy. So that was the abdominal myomectomy for the larger ones. Now, what I do for moderately sized fibroids, we're talking fibroids anywhere between the size of like a pea all the way maybe up to like an orange size fibroids. We do the Acessa procedure for those patients. Now, it's plus or minus on the fertility data, and I let all my patients know that we're gathering data. But my thing is, I don't want my patients get one chance to have a minimally invasive surgery. If not, then they end up with an incision. And so Renee has a little photo up here. On the left side is the ultrasound. So we actually do a laparoscopic surgery, and we have two different screens up. One is the ultrasound here, and then the other side, that's where I'm ultrasounding the uterus. And so the nice thing about Acessa is it allows me to look at every single fibroid in your uterus, and then we take a big needle, it goes into the heart of the fibroid, and then these other smaller needles are deployed to the dimensions of the fibroid, and then we burn it. And that shrinks down. It takes about 3, 6, up to a year to get your best results, but I am just really excited that I am able to offer my patients another option that most other doctors cannot or will not, they just refuse to do because it's hard to learn how to do. And unfortunately, a lot of doctors aren't really on the lookout for what might be best for their patient. So they're just going to do the thing that they've been doing for 20 years and fine, you know what? And this is where I come in because so many of my patients, I have been a primary and a tertiary referral center because most of my patients have already seen their own gyno and they say, just have a hysterectomy. It'll be fine. You'll never bleed again. Well, what if you do want a period? What if you're okay with having a period? You just don't want as much period as what you had before. You don't have to remove the organ. You know, what if you guy said, oh, well, he has a little something on his balls. Oh, just take the balls off.
Never would happen.
People would be in an uproar. But when it's us, when it's our organ, it's just take it out. You're not using it anyway. So what if a man only masturbated and does that mean that he should just lose his balls? Right. Yeah. Anyway, cheers for that one.
Cheers to that.
Right. So as you see now, there are so many different options. Now, somebody did ask about uterine embolization.
Right. Oh, I forgot about that one. So uterine artery embolization is where they take a little guide wire. They can actually go in through your wrist or they go in through the groin. And they take a little wire and that goes into the uterine artery. And that's the main artery that feeds the uterus. Now there's other tributaries. So the uterus doesn't just die outright, but it does shrink down. Caveat for uterine artery embolization, it's an outpatient procedure, but there have been case reports of people, since you cut off the blood supply, I think about it like this. If I'm cutting off the blood supply to my finger and I keep holding it like this, eventually it's going to start throbbing. And eventually, if I keep holding it, something's going to fall off. And there have been case reports where fibroids start to deliver themselves out. That is one thing that I do tell my patients about that. The other case report is women who do have uterine artery embolization in their 40s have a higher risk of going into early menopause. So those are I want to tell my patients that because when I've talked to patients who have discussed uterine artery embolization, nobody told them about that. And for And this is why I'm so glad Tanika is on, because she is such a champion for doing your own research. Sure, listen to what I have to say, but go and do your own research and then bring that research to the physician and challenge that doctor and say, hey, I heard about this other thing right here. What do you think about that?
Absolutely. Just real quick, Dr. Renee,
No, go ahead.
I just want to jump in here. I completely agree with Dr. Nicole. I really look at my medical health professionals as like my board of directors, right? So I'm the CEO of my body, and all of them work for me. And that's the way I look at it. And it's not to challenge their authority. It's not to challenge their years of medical school. But at the end of the day, nobody knows what's happening in my body more than I do. Exactly. So we always tell our patient community, and this is what I've taught myself, that I really have to note what's going in my body. So I have to journal what I'm eating. What are what happens when I eat certain things? How was my period this month? Was it longer? Did I bleed heavier? Did I clot? I have to arm myself with all that information so that when I go to the doctor as a team, we can make the best health decisions for myself, right? When I first decided to really deal with my fibroids, I was offered a hysterectomy my first time. And this was a white male doctor. And I don't want to say it was solely because I was Black. I just think it was because he had just never seen a case like mine. He was from a rural part of Georgia, and he was a visiting physician in Atlanta. And he had just never seen it. So he was like, I don't know.
How old were you? That's the key. How old were you?
Yeah, that's a great point. I was about 25.
That's ridiculous.
Yeah.
That's ridiculous. And single, right?
Yeah. Oh, of course. Yeah.
That's what I'm saying. That's insane. And this is why it's important to have this conversation.
Yes.
Absolutely. Absolutely. And I think sometimes, I don't know if it's just Black women, but I'll speak because I'm a Black woman. But, we have so much allegiance to our stylist and our nail tech, and nobody else is touching our toes. And we kind of have that same allegiance to our doctors. But we really have to figure out ways to be comfortable with second, third, fourth opinions. One of our board members at the White Dress Project heard about Acessa, because Acessa is a partner of ours, what Dr. Nicole just talked about. And she went to her doctor. Her doctor didn't know about Acessa. She was in Houston, didn't know about Acessa, and said to her doctor, for the best interest of our relationship and our patient-doctor situation, I need you to learn more about this. The physician went to a training that Acessa held, and basically, long story short, learned the procedure and was our board member's first patient.
That's
so
great.
You really, really have to advocate for yourself. And to Dr. Nicole's point, it does require additional certification and training and all of that. And not every doctor is in the position to be able to do so. However, if that is not the case and you do feel like those less invasive procedures are right for you, then you have to seek second opinions. The one caveat to that is, as patients, we can't rely on Dr. Google, as you both mentioned in the beginning. We can't rely on our own complete expertise, but as a combination of both, knowing your body and your doctor having the expertise, we should be able to come to solutions that best serve us.
Definitely. Now, is there a certain age when women start to develop fibroids?
Interestingly enough, it appears that African-American women do develop fibroids at an earlier age. And because we start growing them earlier, they get bigger. Earlier. So white women do tend to start becoming symptomatic with their fibroids in their late 30s, early 40s into 40s. We tend to start developing symptoms with our fibroids in our 20s.
Okay.
And then when you think about that, I have a lot of my patients who think that, well, maybe there's something environmental. Maybe if I ate something differently, then perhaps that would make them go away or get better. And I tell everybody, this is unfortunately a genetic issue. And because it is primarily a Black woman issue, there's not going to be billions of dollars spent, not to pan breast cancer awareness, but because this is a Black woman problem, we're not going to get the millions of dollars of research that we need in order to figure out what is that gene that we can identify, because primarily it is in women of African descent, whether you are vegan, whether you eat meat every day, whether you do blackstrap molasses, or whether you do apple cider vinegar.
Somebody just said something about milk thistle.
I'll look it up. I don't know.
Right.
But when I do talk to my patients about these dietary changes, I say eat clean, because that's going to help your overall health.
Right.
But doing certain things to say that that's going to shrink the fibroids and make them go away, that is a misnomer. And I do want to put that out there as something quite serious, because I had a patient who bled down to a hemoglobin of 4. And she was taking some herb, and I said that that's not going to do, because we really have to address the issue outright.
And you know, the thing is, what happens with patients is that we become so desperate, right? Because we don't have another PTO day to come and try to see you, Dr. Nicole, right? We don't have another,
right.
We just don't have
work.
Exactly. We don't have any more money for another copay because we're at the beginning of our, like, we just don't have it. So I see it all the time where there are so many measures that patients take in order to kind of solve this on their own. To your point about veganism, you know, after my first myomectomy, I went vegan probably for about a year, and I still had to have a second myomectomy 3 years later. So I know that there are women out there who, you know, claim that they have passed their fibroids. If you just scroll Instagram, you know, the juices, the herbs, and I'm no doctor, I'm no herbalist, I'm no dietitian, so I'm not trying to discredit any of that. I just know what did not work for me.
Right.
And know that, to your point, Dr. Nicole, that having a balanced lifestyle is overall what's going to be best, but it's not because I necessarily chemically permed my hair 12 years ago. Now my hair has been natural for 15 years.
Right.
I still had to have fibroid surgery in between that. I think what just becomes very frustrating is because we don't know exactly what that genetic component is. We don't know if there are environmental factors that aid in the growth, right?
Yeah. Right.
So we don't know those things for sure. Then because we get so desperate for answers,
we're grasping at straws.
Exactly.
Right. Now, there's a few things that I've told my patients, herbal-wise, have been actually helpful. One is magnesium. I do have my patients take magnesium, which help with cramps. Magnesium, vitamin D, and I also have them do flaxseed oil and any omega-3s. I have found that those, now this is not a panacea, but I think it's a pretty good place to start. And also, if you just don't want to take any other medication other than Advil, if you take Advil, ibuprofen, the day before your cycle, if you're tracking your cycles, that can actually help to reduce your bleeding by about 25%. So there are things that you can do aside from surgery or coming to see the doctor. But like I said, if you start feeling winded, tired, palpitations, short of breath, you need a nap, then it might just be time to, you know, take a PTO and then come see somebody.
Definitely. And you mentioned your fertility. Isn't there a better time to definitely to have a myomectomy or something before you're going to try and have a child, because fibroids do happen to sometimes grow back?
Oh yeah, fibroids do grow back. Average time to fibroid regrowth, the earliest I've seen is about 3 years. The longest is about 7 for somebody who is in her like early 30s. I tell my patients, if you want to try, get your myomectomy, wait about 6 to 12 months. So there's that nice little 6 to 12 month kind of window, then start trying. I've had patients though, but if you, like I said, if you're still alive and you're 31 and you're not married, you don't have a potential partner to have your baby with, if you're still miserable, then we still might want to do something. But we're talking ideal, get your surgery done, 6 months, then start trying.
Okay. Okay, I think that's important for people to understand,
Right.
that you definitely need to know. Now, one, Dr. Nicole, where can we find a doctor? Because, like I said, right now I'm not currently in Chicago, so I'm in Michigan. How can we find a physician that does Accessa and that will talk to us about it? Because we need to figure out, are we a good candidate, right?
Right, for sure. I do know in ATL is Dr. Siani Hawkins, who's also my soror.
Yes.
I know, shame on both of us.
Right.
But, Dr. Hawkins is in ATL, and she's the fibroid queen of Atlanta. I am in Chicago, Illinois. I'm the fibroid queen of Chicago, hopefully. And you can go to accessaprocedure.com, and then you can find a doctor. There's some people out east. There's people, of course, we already got the South covered, and there's a couple doctors out west who are actively in training. Accessa just got bought by Hologic, so there's going to be a lot more doctors in training. And I personally do the training myself, so I run some of the training. So we will certainly have more doctors, but that's the best place is their website, accessaprocedure.com.
ACESSA?
ACESSA.
Gotcha. Procedure.com. Got it. Got it. We're going to have it up here in 2 seconds. Okay, there you go. Yep. So you guys, this is where you can go to find a doctor to do it. But Dr. Nicole, in the land of COVID, are you doing telemedicine?
I am. So if you are not happen to be in Chicago and you're not at ATL, like say you're in Houston or something like that, and you still want to talk to me, we are doing telehealth visits. Just email us your ultrasound. I can do a pretty thorough review of all of your scans and everything, go through all of your records and go, okay, yeah, I believe that you're a good candidate. Let me find somebody who's within 50 miles or just fly on up Chicago, spend a weekend in one of the safer hotels that we have, and then we'll get your work done.
Okay.
Even if Accessa isn't the thing for you,
right?
You want a doctor who does this every week.
Yeah,
absolutely.
Where can they find you?
You can find me at www.gynecologyinstitute.com.
And here you go, gynecologyinstitute.com.
That's right.
And you can find Dr. Nicole. And then I have to have Tanika talk about her fabulous program.
Yes, it's great.
Please tell us about why we can wear white.
Yes, we can wear white because we are creating a community of women who understand that they do not have to suffer in silence with fibroids. We wear white for each other. We wear white to build community. And anyone with a symptomatic fibroids, it resonates with them that you don't feel comfortable wearing white because your periods are out of control, you're bloated, the pain. So it's just something that, you don't even notice that you don't do. But you don't do it. And it's important that we build community together. I'm so excited about the community that we've built. And one of the important things about our organization is that we do not claim to be doctors at all. We have doctors like Dr. Renee and Dr. Nicole at our disposal, Dr. Soini, like Dr. Nicole mentioned, Dr. Jessica Shepherd. We have doctors all across the country who are versed in new procedures, who are up on the latest data from Mayo Clinic and Office of Women's Health and NIH and all of those things. So we have strategically partnered with physicians who can get answers for you. So that's one of the things that I love about our organization is that we've really found a way to share our story, patient advocates, and connect with physicians. And before we go, I really want to tell everybody that you really, really, really have to be your own best health advocate. Nobody is going to care like you do, and nobody's going to understand what's going on in your body like you do. If you don't feel something's right, if the relationship isn't right with your physician, get a new one. Like it's literally that simple.
And there's one other thing I want to make sure we cover. Dr. Nicole will agree with me. Mm-hmm. If your fibroids are not causing you a problem,
leave them alone.
Exactly. I was just going to say. So, you guys, that means that if they're not bothering you, don't bother them.
I got one right now. It's 3.4 centimeters.
Yeah. So it's not bothering you. Don't bother them.
Yes.
You can also be pregnant and have a fibroid in the same uterus.
Yep.
And deliver a healthy baby.
Yes.
So I think these are just a few things that I just want to make sure that people understood and knew.
Right.
I'm sorry to cut you off, Tanika, but I just want to make sure that we said that, because I know people are like, oh, I got it. No, you don't have to necessarily. Because once you get an ultrasound, the doctor might find a fibroid and they might just inform you that you have it. That doesn't mean something has to be done.
Right.
I will just say, from the patient perspective, wait and watch is all good and well, but you got to watch them. Like,
you got to watch them. So, I do ultrasounds on my patients, my younger patients, every year. And then once my patients start getting in their 30s, if it's kind of like 2-3 centimeters, 6 months, 6 months, 6 months, because I want to catch them and be able to get them and treat them at an appropriate time before they get out of control.
Absolutely.
Okay, I'm trying to see. Somebody said that I wasn't answering questions, but I don't see them. Somebody just put IUD question marks. I'm not sure what that question is.
It can help with heavy periods.
Okay, thank you. We talked about fibroids with pregnancy. That was one question.
And endometriosis is a whole other talk. But
she said, would you ladies start a community of doctors across the states as a resource for people watching? There is a community of doctors. It's here, blackdoctor.org. If you go to the website, type in whatever specialty you're looking for, wherever you're located, and you should be able to find a Black doctor.
Absolutely.
Do the use of tampons contribute to the development of fibroids?
Does what?
The use of tampons contribute to the... I said no.
Use a tampon. Don't feel anything if you don't have to.
Yep. Okay, I think, eating clean isn't going to change your genetics. This is true. Yep. So you guys, if you have other questions, Dr. Nicole is on social media. Please, follow her. She's on Instagram. She has a very fabulous Facebook page, the Gynecology Institute of Chicago, right? Or does it not say? Yeah, I thought so. So and I tagged it in this post as well. So please go over to her Facebook page and ask her questions. She's more than happy. And then also, if you need to set up a telemedicine visit, please do, because she definitely can help you to find someone that's in your area. She's willing to look at your scans and tell you what she thinks. You guys, never be afraid of a first, second, and third opinion. Never be afraid of it. Also, we all advocate Black doctor here. I think Black male OBGYNs are just as great as Black female OBGYNs.
Yep, my partner is a man. My medical partner is a man, Dr. Pierre Johnson, and he's also trained in lap myo, robotic myo, mini lap, and Accessa.
And I had no idea of that. I know Pierre too. So, but I did know he did Accessa. I didn't know he was your partner though. But so Pierre's amazing. So you guys, please, I must say, I think there's something about a doctor that looks like you because they understand. So that's why I'm here at blackdoctor.org to help you to understand that you should really try to find Black doctors. There's been studies done that tells you that we do get better treatment from people that look like us.
Yep.
So, please, please, please. And I don't think, I know Dr. Pierre is a fabulous OBGYN. So I know Dr. Pierre is just as compassionate with his patients as Dr. Nicole is, because there was, a question about male or female. Nope. I think that he's just as passionate. I think that you have to figure out what's your choice. Me personally, I want a female doctor. That's just me. But, my mother, I was delivered by a male OBGYN. Me and my sister, my mother had a male OBGYN. So it's just your personal preference, I think, there. Yeah. But I do believe that you really should try to find Black doctors. And if your doctor in your 20-something says you should have a hysterectomy, you should probably go get 2 opinions to just make certain that they know what they're talking about, because that may not be the end all be all. Because, with a hysterectomy comes a lot of hormonal changes sometimes. And at 20-something, you may not want to go through that.
Yeah, exactly.
Yeah. So, ladies, thank you so much. I greatly appreciate it. Tanika, We Can Wear White is your Instagram, correct?
Yes, at We Can Wear White.
Yes. And if you type in We Can Wear White on Facebook, which I tagged in the post as well, that is their Facebook page. She has chapters all over the country, you ladies. If you have fibroids, then you need to make sure you're part of the White Dress Project. It is a nonprofit, but they have really great, it's a really great support group. And they obviously have great information coming in there so that you can learn about these things in case your doctor didn't tell you, you can learn about them there.
Exactly.
So thank you, ladies, so much for joining me this evening.
It's a pleasure.
And I think the ladies in the audience have have, like I said, lots of questions here. Somebody said I live in Omaha and they just don't have Black doctors. That might be true. Although, remember Omaha, Nebraska is where the Black OBGYN delivered those sextuplets or something. It was a large, it was like 10, 15 years ago, remember?
Yeah.
It was 2 Black women, I think. So there are Black OBGYNs, clearly, because they delivered the babies.
Yes.
So you guys, thank you so much, everyone. See you next time at blackdoctor.org.
Thank you.
Bye.
Bye.